So good evening, everyone. Welcome to today's session, breastfeeding questions asked, and you can ask me any question, and I'll just try my best to reply, give the best reply for you all. So first, I'll take the questions which are there in the Google form, and you can start writing your questions in the chat box, and I'll take one by one. So I'm just first seeing the questions which are already there on the form which you have filled. I'll take the ones which are a little different. The common questions I'll answer all together. So because two common things which I see everyone asking is low milk supply and latching issues that I'll cover differently, separately, I mean. So first I'll see if I have some new questions. So one question is from Shalini, right nipple getting too much pain. So if there is specifically you are facing pain in one breast, the other breast is all fine. So in that way, I would suggest that it is basically a latching issue. I mean, there might be few other issues also, because if it is not paining the other breast, that means the baby knows how to latch. You know how to latch the right side, because mostly mothers feel that they have one side milk supply less than the other. So that might be a reason that the supply is less on that side and baby has to make more vigorous efforts that side. So it might be painful that side, and also because we are more comfortable holding the baby one side. So you just need to check on that. And if you feel the flow is less or the supply is less, then just work around it, Shalini. Now let me see the other question. Low milk supply, baby refuses to take the feed. My issue is low milk supply. Mostly I see low milk supply. Baby won't sleep after. So this is one question from Sapna Obale. Baby won't sleep after breastfeeding for 1 hour. So always remember, if the babies are feeding for long, like 45 minutes, 1 hour, don't feel that they are breastfeeding for so long. Babies usually feed 15, 20 or max 25 minutes. If they are feeding for such long times, they are sleeping on the breast. So don't think that, oh, I fed for 45 minutes, 1 hour, still my baby is hungry, because they were not feeding properly. They were basically sleeping on the breast. So you need to observe the active feeding. And how you can observe the active feeding? When we drink any liquid, we can see the gulping movement in the neck. So that you have to observe in your baby's neck. So if you are seeing that the baby is having good gulps, deep gulps, that means the baby is feeding. If you're not seeing a proper gulping movement, that is not an active feeding and the baby is sleeping on the breast. Next question. Solution for biting during breastfeeding due to teething period for my child. Very good question, Vaishnavi. This question is from Vaishnavi. So let me answer this in a proper way, because all of you will be facing this once your baby grows and reach the teething phase. So this is for all of you. Listen. So babies don't bite involuntarily. Okay. So if they are teething, they have a lot of irritation in their gums, which they want to just nibble upon, and breast is quite soft, so that becomes easy for them to nibble upon. So what few things we need to understand: the baby is not very cranky, or the baby is not irritated when we are taking them on the breast. So what we have to do, we have to make sure the baby is calm. Don't take a agitated child on the breast, because when they will come on the breast, they will bite. So if your baby is cranky, angry and not well, then first calm them and then only take them on the breast. If you take an agitated baby on the breast, specifically when they're teething, because during teething, they are very cranky. So if you take a cranky baby on the breast, there are high chances that the baby starts biting. Second thing, when the baby starts biting, on the first bite itself, you have to be strong there. You have to say as rigid no. If you just say, you bite me, you something like that, or you just smile, hey, baby, why are you doing like that? So baby doesn't know that. The baby feels that they are doing something good because you gave them attention. So at that time, they will keep repeating it. So in that way, what you have to do, if the baby is biting, first take a finger, tap here and say no. A firm no. If the baby doesn't leave the breast still, you unlash them and tell them, I am not going to feed you. Babies understand very well. Okay. So what you have to do, you have to first make a good communication with them. If you just try to force them on the breast, they will bite. And if they are biting, if you're not doing anything for it, they will keep repeating it. So that's why you have to make sure that you have a better communication for your child, and firmly say no when they are biting. And for that, you just remove them from the breast and don't feed for some time. They will understand that they shouldn't bite. So these are few things you have to understand when the baby starts biting. Most I am seeing low milk supply issues only, whatever you have written. So let me start the Q&A and see what are the questions coming in live. First, tell me how many of you are attending this live session for the first time. Just write me in the chat box, like you are attending this session for the first time. Zinal, Sindhu, Harkirat, Sapna, Mrudla. Okay. Ravina, second time. Okay. Natasha. Who else? Pooja. Okay. So you all are attending. Third time, Meenal is third time. Okay. Good. So the second time, third time, if you are joining, that means you find these Q&A sessions valuable and helpful. So you are coming. That's very good. So let me also see who all are here and say a quick hi to everyone. So I see Bharti, Bindu, Debasmita, Dr. Monica, Harapriya, Harkirat, Latha, Maria, Meenal. Hello, everyone. Mrudla, Natasha, Nikhat, Padmavati, Pinky, Preeti Gupta, Pooja, Reena, Ruchika, Sapna, hi, Sharmila, Sindhu, Avantika. Very nice. A very warm welcome to all of you. So let's start taking the questions. And also, please tell me who all are here who have not taken any consultation. You are new to us. Just write N, that you have not taken any consultation from anyone, any of our me or my consultants, and you are very new. So when somebody is writing with iPhone, please write your name. I don't have your this. So many people are new here. Mridla, Sindhu, Padmavati, Pooja, Harkirat, Natasha, Nikhat. Many people are new also. Awesome. Welcome. Welcome to the community. So let's take the question answers. And the questions which I'll take, if you want, you can also unmute yourself, but I'll take that at the last. So first let me finish, and then I'll see if I have time to unmute and ask, discuss some questions with you all. So Sonika, her question is, hi ma'am, I have very low milk supply. My baby is 20 days old. Okay. So low milk supply will come after 2, 3, 5 minutes, because most of you join by thoda late and then you keep repeating, please repeat, please repeat. So I'll take this low milk supply question little later. Dr. Monica says, is domperidone compulsory? So I see that you yourself are a doctor. So Dr. Monica, like what is the like doubt about domperidone if it is advised to you by your lactation consultant? So domperidone is used for improving the milk supply. So let me know what is the concern behind that. You are yourself a doctor. You've written Dr. Monica Gupta. So you know about the usefulness of domperidone for low milk supply. Just let me know that what is the concern you're feeling about domperidone. Latha, what is the reason for low milk supply? Good question, Latha. So basically, all of you understand why we face low milk supply. So nature never does wrong. Nature produces enough milk for every mother to feed their babies. What happens if your baby is not put on the breast, the baby is given formula milk or something by in the ICU or by in the hospital, or the baby is not put on the breast regularly, there is not enough demand. The first letdown thing doesn't happen. So what happens? The babies when they are born, their stomach the stomach capacity is only 8 ml. So if we give 30 ml milk to them, they'll keep sleeping for long and they will not come on the breast. So what happens? That initial letdown doesn't happen. So after 2, 3, 4 days, when the mother and the family realize, oh, the baby is not feeding, let us try to put the baby on the breast. We have already increased the intake of the baby to 30 ml because that has been given to the child in the hospital. Now what happens? The mother, once she starts making milk, keeping in mind that the nature, when the baby is born, day one, the baby's stomach capacity is 8 ml. So the colostrum which comes initially is very less in quantity. So third, fourth day when you are trying to start the breastfeeding, the milk is coming very less and your baby is not sufficed because the baby is habitual to 20-30 ml of milk. Now when the baby cries, the baby is a small baby, apple of eye of everyone in the house. Now when the baby cries, nobody likes it. Even the mother herself doesn't like it. So what happens? We don't like a crying baby. So what we do, we supplement. We keep supplementing. So we keep supplementing with formula milk. So what happens? For the human body, there is a gap which has to be, which was intense, like which was originally planned to let the baby come on the breast on a regular intervals. But now because the baby is crying, not coming on the breast, the family, the mother, everybody keeps feeding them formula and keep trying them. After formula, the baby is full, the baby doesn't want to feed, the baby sleeps again for 2, 3, 4 hours. In the night when they are very active, the family doesn't want the baby to cry. And that is the reason that we disturb that demand cycle and the supply goes down. Clear is Lata? So basically a disturbance in the demand supply chain is what is the reason behind low milk supply. Next, Ravina. Can gestational diabetes affect milk supply? Good question. So basically for any medical problems, if you have hypertension, high thyroid, low hemoglobin, gestational diabetes, always remember any medical condition, if it is balanced, like if it is controlled, it will not cause any problem with breastfeeding. But if the gestational diabetes is not controlled, the level is more, then it might cause difficulty with breastfeeding. Okay, so basically any medical condition, if it is controlled within limits, it will not cause any problem. Sapna. Hi doc, I breastfeed my baby for 1 hour and still when input him down, he cries for milk. I don't understand why this is happening. I tried everything. I do pumping too and feed my pump milk after breastfeeding, and at night I need to formula feed him. Okay, so as you said, Sapna, you breastfeed for 1 hour. Still, when I put him down, he cries. So basically what happens when you're putting the baby on the breast for 1 hour, the baby is not drinking actively. The baby is sleeping in between. So I just told you that you have to see the gulping movements in the neck. If the baby is not gulping properly, that is not an active feeding. You shouldn't continue feeding for that long. And obviously after removing, if the baby cries, then you shift the baby to the other breast. If still the baby cries, you can supplement with whatever you are doing. But both the breasts, you need to check. You need to check the color of the milk. If the color of the milk is coming thick white, that means the baby has not emptied the breast. In that case, you pump. Next. Lata, my 2-month-old daughter likes to bottle feed. She ignored breastfeeding. Can you please tell me how to overcome this issue? So what happens? See, babies are not wrong at that because they were exposed to bottles at the start itself. Now, what is the issue with the bottle and why the babies don't come on the breast? See, bottles are easy for the babies. They get a good flow. It is easy for them. Nobody disturbs them. A new mom, how she's holding the baby. With the bottle, anybody can feed. The babies are very comfortable. They are independent, getting good milk, good flow. All these things count. Now you can reverse the process by cuddling your baby, keeping the baby skin to skin with you, like caressing with the baby. All these things you need to do. And also you have to work on your flow, on your supply, supply, and also your latch things. So basically these 3 things have to be improved if you have to get your baby from bottle to breast. हिबा, हाय मैम, मिल्क कुछ भी नहीं आ रहा है, हमें क्या करना है इसमें? मिल्क लो मिल्क सप्लाई के लिए मैं भी थोड़ी देर में आंसर करूंगी. Sharmishta, ma'am, I am a mother to 5-month-old kid due to some health issues, had less milk supply. Can I still increase it in 5 months? Yes, Sharmishta, you can definitely increase your milk supply even for 5-month baby. Dr. Monica Gupta, my baby is not latching at all. Is it possible to continue breast milk supply with pump? Yes, Dr. Monica. So for you specifically, I will tell you that there is a Momstar series of Dr. Alia. She is an anesthetist and her success story is there on my YouTube channel under the Momstar series. So you can observe that she's an anesthetist, and because her baby didn't breastfeed directly since very long, so we started pumping for her. And later on with exclusive pumping, she started producing oversupply of milk. So from zero supply, she had also oversupply. You can just watch that video on my YouTube channel. It is in the, her name is Dr. Alia, and you can just search on my channel. In my channel, you can find on YouTube in the name of Dr. Tanima Singhal, and you will get here my channel. You can just watch those Mom Star series. It will motivate you. And yes, with exclusive pumping also, you can increase your milk supply. Natasha. Good evening, everyone. Madam, thank you for conducting these sessions. They are really helpful for us, new moms. My question for new mom is that my baby is that I have a low milk supply and my baby's stomach remains empty. I then go to formula feed. This is the situation in the night, and in the day milk is even low, so straight formula. I have started with a routine pumping schedule. By the quantum varies from 5 to 30 ml in one pump, which is nowhere. Please advise. So girls, always remember, please don't focus on the quantity of breast milk which you are producing. Always remember there is one more component called as breast milk composition. We are not machines. We don't produce same kind of milk every time. If you start working on your supply flow and all that, obviously your milk composition will change. So don't keep in mind that, oh, I produce between 5 to 25 ml. Don't label yourself with that. If you are regularly pumping on the same times regularly, like 15-20 minutes here and there, and if you are giving regular demands to your brain will understand that demand, and accordingly it will start making milk, and also it will start changing the composition of the milk as per the demand. So now if you are pumping around 8 times, the body will understand, and accordingly it will keep changing the composition. So don't worry if your milk supply is coming less with the pump. And also if you are a breastfeeding mother and you are pumping after breastfeeding or between like 2 sessions, then for breastfeeding mothers, pump output is not the correct indicator of how much milk you are producing, because it varies. So for breastfeeding mothers specifically, pump production is not the reliable factor. But for if you are not a breastfeeding mother, you are not able to breastfeed your baby, then you start pumping, and whatever milk you are producing, just keep regularly doing it. That will help to improve your milk supply. Dr. Monica Gupta, is pump equivalent to baby sucking? No, it is not. But the difference, let me tell you the difference. When the baby suckles on the breast, there is an like oxytocin and prolactin, like hormonal stimulation to the brain, and that let down things happen. With the pump, it doesn't come that way because that is an artificial thing. But to create a demand, like for why do we do pumping? If it is a breastfeeding mother and if the pump is advised, that is specifically if the baby is not able to empty the breast, we just do it to empty the breast. Second, if the baby is not latching on the breast, then obviously we have to pump because we can't leave the thing. If the baby is not latching, can we leave that? Okay, we will not be able to give breast milk. So basically pump is not equivalent to baby sucking, but it is equivalent that it can produce same amount of milk which is required for the child if you do consistent efforts. Debasmita, hello ma'am. Hello Debasmita. Meenal, हेलो मैम, मेरा बेबी का 1.5 महीने का वैक्सीन हुआ है, आज 4th डे है। 2 दिन वैक्सीनेशन के कारण वो बहुत स्लीपी थी, उसके कारण फीड नहीं कर पाई बराबर। उसका 15 अक्टूबर को 4.4 kg वेट था, बट अब आफ्टर 1 वीक सिर्फ 4.8 हुआ है। इज इट नॉर्मल? क्या वैक्सीन के कारण बेबी के फीडिंग पर या वेट पर ऐसा इफेक्ट हो सकता है? एक हफ्ते में 4.4 से 4.8, 400 ग्राम्स तो अच्छा वेट है, इसमें क्या प्रॉब्लम है? अगर सपोज मैं आपको मानूं, एक हफ्ते में 400 ग्राम्स तो बहुत अच्छा वेट गेन है मीनल। आपका बेबी अभी 1.5 महीने का है, मुझे तो 150 से 200 ग्राम चाहिए उसका एक हफ्ते में। 400 ग्राम्स तो बहुत अच्छा वेट है मीनल, आपको कम क्यों लग रहा है? प्रीति, मैम बेबी को मिल्क नहीं पिला पा रहे हैं, मिल्क इंक्रीज नहीं होता है और बेबी फीडिंग भी नहीं कर रहा है। ओके, देखो लो मिल्क सप्लाई के लिए थोड़ा रुको, मैं अभी आंसर करती हूँ। Harkirat, is it okay to give formula milk if I am breastfeeding properly? So if you are breastfeeding properly, why do you want to give formula milk, Harkirat? Nikhat, I have low milk supply, please help. Okay. Nikhat, मेरा बेबी 20 to 25 मिनट्स फीड करने के बाद भी रोती है और पीने मांगती है, उसका पेट नहीं भरता है, फिर मुझे फॉर्मूला मिल्क बना कर देना पड़ता है। मेरा ब्रेस्ट प्रेस करने पर भी मिल्क बाहर नहीं आता है और मेरा बेबी का वेट भी सही नहीं बढ़ रहा है। तो ठीक है निखत, इसका मतलब है कि आपका मिल्क सप्लाई का इशू है, फ्लो का इशू है, और लैचिंग का भी हो सकता है। अगर आपके बच्चे अच्छे से फीडिंग कर रहा है तो लैचिंग का इशू नहीं है, लेकिन सप्लाई और फ्लो का इशू तो है। सपना, इवन व्हेन आई फीड हिम एनी डे, एनी टाइम, even when I feed him any time a day, he is not satisfied with my breast milk. I somehow have to give him bottle feed. What and how can I make him satisfied with my breastfeed? Okay, let me first answer your questions about low milk supply. So all of you listen very carefully. For low milk supply, now I will not keep repeating it every time because this is a very common question asked every time. So for low milk supply, what you need to do? First of all, you have to create a demand and supply pattern. So if your baby is already coming on the breast, then what you have to do? You have to breastfeed your child every demand, and after that you have to pump. Don't expect milk in the pump, basically, because we want the baby to finish all the milk, and we don't want any milk in the pump. But this pump will improve increase the demand of the milk for the brain, and the brain will understand this demand and will start making more milk. So here the pumping is not to get the milk, basically it is to give the demand to the brain to increase the milk production. Second point, if your baby is not at all latching, then you have to start pumping. You can start with 4-hourly and 6-hourly or 4-hourly is a better one because 6-hourly will be too less. So you have to start 4-hourly, and also you need to like pump, and then you can do hand express also. Now, this is about demand and supply. The other things we have to work upon is your hydration. Second thing is for flow, you have to do oil massage and warm compresses. Third are galactogogues. So you have to take some galactogogues. So galactogogues, what I recommend is lactomagic powder and Morico tablets. Fifth is you have to keep the baby skin to skin with you. Next is you have to check the baby's weight gain and keep a track of your formula intake. If the formula milk with time weekly is coming down and the baby's weight is increasing, that means you're on the correct path. Next. Next question is, this is from Nikhat. I am mother of 5-month baby boy. During the starting time, my nipple wasn't there, so unable to give. It's fine. So always remember, flat nipple or inverted nipple is not a major issue. You can latch the baby with right latching techniques. You have to hold the breast, press the breast, and then latch the baby with the areola. So that way, flat nipple or no nipple or small nipple or something is not a big issue. You have to learn the proper latching techniques. And if any one of you is failing that my milk supply is good, but I have only latching issues, then we have a dedicated latch expert in our team. You can contact the team and get a latch expert advice with your consultation booked with the latch expert. So that way it will be help for you. And if you are facing low milk supply issue and latching issues, then you obviously, we have a lot of lactation experts in our team. You can contact the team and get a customized treatment plan for you. Sharmila. Ma'am, hi ma'am, my baby is 4.5 months old and not sucking on my breast. So basically it would be because of supply issue or the flow issue. I've just answered that. You can work on it. So when I give you any tips and tricks, that are generalized tips and tricks. So if you want to work on that by yourself, you can work for 1 week and then see. If it is not working and not giving you good results, then just don't keep repeating it. Get a customized consultation done for you, get a consultation booked for you. We have very good experts, and get your issue resolved. Just don't wait for some free quick tips for that. Your baby is growing very fast. This is the time that you have to give right foundation. If you are planning that, okay, I'll see some free tips on internet, on YouTube and all that, it will take time, and we don't have time. Our baby is growing very fast, and this is the time we have to give them good foundation. And if your baby is already 1 month plus, obviously we are late. We have to start it as soon as possible. Once the baby grows, then you start feeding. It might help, but if you start early, that will give you best results. Due to short cervix, I was on high medication for 6 months. Thus, medication affects milk supply. So during pregnancy, it was not whatever was given, and for cervix, you would be given progesterone for supporting the pregnancy, but that's fine. That will not cause any milk supply issues now. See, because many mothers go through IVF also, and they come to us for milk supply issues. Even they get very good results. So don't worry about the hormones were given to you during pregnancy. So it's not an issue. Dr. Monica Gupta, I have severe gastritis with domperidone. Do I need to continue? So if you're having gastritis issues, then you can shift to the other one. So just talk to your doctor, whoever has prescribed to you. So along with domperidone, there is one more allopathic medicine which is also used for improving the milk supply. If you already know about it, but just talk to the doctor. Otherwise, just tell them, they will give you one more. One more thing is there. And also you can take something, because domperidone is already used for like vomiting thing and all that. So if you are facing severe gastritis, reduce the dosage and see, or you can take something which will help you in your gastritis issue. So that way it is there. But obviously, if we don't take it, we will be getting milk supply better, but that will take more time. With these things, we get the milk supply faster. That is the only thing. Sharmishta. Hello, ma'am. I'm Sharmishta. I want to know if I can start breastfeeding after 5 months. Due to some reason, was not able to give breastfeeding exclusively for some days. Yes, Sharmishta, you can definitely restart your journey even after 5 months. Nikhat. Ma'am, मेरा baby 3.5 month old, मेरा बेटी 20-25 मिनट फीड करती है. ये मैं आंसर कर चुकी हूँ ना. Padmavati, hi madam, how to manage comfort sucking? Often it leads to sore nipples and pain. So if you are seeing that your baby is doing comfort feeding, then what you have to do, you have to just make sure the baby should be latching deep. So now if you touch your tongue to the back side of your palate, which is called a soft palate, you'll see a dome thing there. So if your baby is wanting to do a comfort feeding, make sure the baby does a deep latch so that your nipples are safe and secure, so that they don't get hurted. Nikhat, how can I get to know that my milk flow is good? So what you have to do, if you have to feed your baby, and if the baby gets sufficed, the baby is gaining weight well, and you are not dependent on formula milk, that's where your milk supply is good. Sharmila, same issue, baby is taking feed in bottle and refusing breast. So basically, because baby would have been given bottle at the very beginning, so the baby is habitual to the bottle. So what we need to do, we have to work on our supply, flow and latch issues. The baby will definitely start coming on the breast also later on. Ma'am, I'm mother of 5 months, but मेरी निपल नहीं बनी थी, so I was unable to feed. मैंने अभी इसका आंसर, आप लोग एक ही क्वेश्चन को बार बार रिपीट क्यों कर रहे हो? मैंने आपको बताया था ना कि निपल से नहीं होता है कोई प्रॉब्लम. आपका फ्लैट निपल, इन्वर्टेड निपल, स्मॉल निपल कुछ भी है, आप लैचिंग टेक्निक सही यूज करिए, क्रॉस क्रेडल होल्ड फॉलो करिए, ब्रेस्ट को प्रेस करके आप एरियोला से फीडिंग कराइए. निखत, आपके मैसेज का मैं जवाब बार बार दे रही हूँ, आप एक ही क्वेश्चन क्यों बोल, आपको आवाज नहीं आ रहा है क्या? Meenal, can we measure the accurate amount of milk we are producing if I am direct breastfeeding mother? So you can't measure the milk. You can just see your baby's weight gain. If you are not giving any formula milk to your child, the baby should gain weight properly. So you should just keep a track of your baby's weight. So every Sunday to Sunday, you can check your baby's weight. The baby should gain weight steadily. And if it is happening, that you have good amount of milk. Harkirat. Ma'am, family pressure to give formula milk because they tell baby will forget how to suck from bottle and baby is taking breast milk after 1 hour. So basically, see, always remember frequent feeding is always good. If the baby is feeding for in 1 hour also, how long will the baby feed so frequently? It is a matter of 3, 4, 5 months. You can't spend that 3, 4, 5 months with your child. Once they grow, they will not stay with you. They will obviously go and play with everyone. It's a matter when you have waited for 9 months for your baby, you can't spend hourly time with your child for 2, 3 months. It will. Once the babies will grow, they will not ask for milk every 1 hour. So don't worry that now my baby is feeding every 1 hour, so you are getting worried, how will I manage? It's a matter of few months. And also family pressure, I just don't like this word because see, you all are educated, good, like educated mothers. You are using internet, you have your access to internet, you are all educated. You can take the decisions for yourself. See, parenting has to be done very strongly. This is just the starting. There are a lot of decisions which will come in the life which you have to take for your child. So this is the time where you have to take for your right foundation of your child. And if you're not taking that decision by yourself and getting influenced by people, then how you are going to raise your child? You will always get confused when your baby, like the baby is growing. Don't give that and you will just listen to everyone. This is just the starting. You have to take a firm decision on what has to be done for your child's good health. Obviously, you are the mother. So you will not think anything bad for your child. I say, yes, the family also doesn't want anything bad. But breast milk, everybody knows that breast milk is the best thing for the child. Then what is forcing them to give formula milk? Because you are not sure about your breast milk, because you are not confident about your breastfeeding. So basically you need to have good support system here, where you are confident about your milk supply, and when you are confident, nobody can change you, like force you to give formula to the child. Pooja, do we need to pump on same day, same time every day? So basically, see, if you are starting the process of for low milk supply and starting pumping for low milk supply, then obviously you have to try to pump during those specific times itself. Because if you keep changing the times, the brain gets confused. But if you're already a breastfeeding mother, you're feeding every time, then pumping is not like you have to pump at specific time only. Padmavati, madam, my nipples are edematous like nipple blebs, but no pus points. How to manage this? So basically, this will happen when the breasts are not getting emptied regularly. So do oil massage, warm compress, and then express the milk or latch the baby properly in a deep latch. Sharmila, ma'am, can we get the recording session? So it will be put on the YouTube channel. So you have to subscribe the YouTube channel and press the bell icon. So every time a new video will come in, you will get the notification. So all these Q&A sessions are there on the YouTube channel. You can just find them. Maybe tomorrow or day after tomorrow, it will be uploaded there. Lavanya, my baby was 3 months old. Milk supply is low. So already answered about low milk supply. Sharmishta, how can I restart after 5 months? So basically for 5 months, I will suggest not to wait. Reach out to the team and get your consultation booked as soon as possible, because now we don't have time for these free tips and free solutions. Pranjal, ma'am, white spot on my left breast and nipple pain. So this is a bleb. So for bleb, you have to first work on your latching techniques. Also, you need to take some warm water, put little salt in that, and take this mixture and apply slowly on the breast. So this you have to do regularly, and also you have to work on your latching techniques. Bleb comes only when your latching is shallow. Pooja, I was having low hemoglobin. Does it affect milk supply? So yes, initially it might affect, but now if your hemoglobin is okay, you can start working on your milk supply. It will be okay, back to track. Sapna, till how long do we need to keep this process of pumping on? Or is there any particular timing, like how many months to keep pumping so that milk is produced without pumping too? So Sapna, basically in the initial days, we have to start pumping regularly and smaller intervals of time. Now, suppose we reached a level where we are sufficient and we know this much milk we want. Now what we will do, we'll start. Now our body is knowing that this much milk has to be produced. Slowly, we'll start reducing one pump slowly after 3 days, 4 days, or maybe 5 days. So we start reducing pumps and maintain at a level where we get sufficient milk. And also because our baby keeps growing, so once the solids are started, the dependency of milk will be less. So with less pumps, we will be able to suffice our baby. Lavanya, hi ma'am, my baby was 4 months old. Milk supply is low. Is there chances to increase? Yes, definitely. But for 4 months, I will not advise you to try your free tips and tricks. Reach out to the team and get a consultation booked for you. Harkirat, ma'am, my baby is 2 months and he's having tongue tie. When to go for surgery? For tongue tie, actually, you have to first make sure that it is a deep tongue tie or not. If you are seeing that when the baby is taking out the tongue and you are seeing that a heart kind of a thing there, then this is a true tongue tie. And if you're not seeing that, we can work upon a latch and see if the latch improves with that you might not be needing the surgery. Padmavati, how to identify the correct size of an electric breast pump? So basically, when the pump is put on the breast, you have to see the tunnel, and the nipple and a little part of areola should be going in the tunnel. And if it is happening, that is the correct size, plant size for your breast. Nikhat, my baby is now 3 months, 20 days old. Her birth weight was 3 kgs. What should be her weight now? So 3 months is 2.4 and then 15 days more. No? So 3. 2.4, 4, 5, 6, 7, 2.7, 3, 4, 5, 5.7, nearly 5.7 should be the weight now at 3 months, 20 days. Natasha, madam, my baby is 3 months old. Can I follow a pumping routine to increase my milk supply? And the schedule should be pre-scheduled because post 6 months, I have to resume work. Yes, you can do, Natasha. Okay. So the questions are done. So Pranjal says, ma'am, for pumping, which pump is best? So you can go for the wearable pumps. So in wearable pumps, the most common brands which are good are HealthSense, True, this one, Bump to Cradle, Morrison. These few brands I have heard from mothers doing good. Sapna, my baby won't sleep after breastfeeding at night too and in the day too. Obviously, you have to work on your supply, flow, and latch. All the three things together, Sapna. So I have few like 10 minutes here. I can take 2-3 questions. So if you want to like talk to me directly, you can raise your hand. I'll unmute you. Otherwise, we can just wind up the session. I don't see any new questions coming in. So if there's somebody who want to talk, can raise your hand and I can just allow you to open. But you have to keep your cameras on. Without camera, I'll not allow you to talk. So if anyone wants to talk, raise your hand. I'll just unmute you. I see one question, 2-3 questions. I'll take those questions if nobody's in like there. Sakshi says, my baby weight was 3.5 at the time of birth. Now she's 4 months, 9 days. Weight कितना होना चाहिए? अच्छा मैं calculate करके बता. 3.5 birth पे 4 months तो 2.4 4 महीना उधर और 1 महीना उधर 9 5 607 7 और अभी 16 around 6.6 Sakshi, nearly 6.6. Okay, so Sapna, you can unmute. But you have to on your camera, Sapna. If I don't see your camera, I not.
Yes.
Yes,
Hi, ma'am.
Yes, tell me.
I have taken a consultation of Dr. Bini Gupta with Dr. Bini Gupta regarding the latching issue and everything. So before delivering my baby. So at that time, she had consulted me everything nicely, and that is why I am breastfeeding my baby now. So thanks for that.
Congratulations.
Thanks a lot. Because first, I am having two babies. One baby is two years old, and second is just 2 months. So first baby, I hadn't breastfeeded him at all because there was very low milk supply. Now, just because Dr. Bini Gupta consulted, I am breastfeeding my second baby. But now, what I am facing is whenever I am breastfeeding him, he is never satisfied. Entire day, I am pumping also, and I feel my milk supply is enough. Like 200, 250 ml in the entire day, it is there. And I keep on pumping and breastfeeding. But then too, he is
What
never.
are the last weight gains? Tell me the weights.
Now he is 3.710.
And 3.7, what was the birth weight?
2.6.
And the baby is how many days old now?
Now proper 2 months old.
And this 3.7 was done on which date?
Today itself.
So the baby has gained only 1 kg, 100 grams till now.
Yeah.
So obviously for 2 months baby, we need around 200 grams per week. So 2 months is around 8 weeks. So nearly we need 1.6. The baby has gained 1.1 till now. Okay. And
Yes.
are you giving any formula milk right now?
Yes, at night I am giving formula.
How many times?
Entire night, I guess, because he is never sleeping and he is cluster feeding in the night.
Okay.
He keeps
So
on
what I would
crying.
suggest here for weight, what you do after every breastfeeding, you just see color. If the color is looking thick white, that means the baby has not emptied the breast. Just hand express or pump that milk. That will be not much, 5-10 ml. Just keep giving that milk to your child. That will increase his weight. Regarding the thing in the night, so Dr. Bini would have also advised you some medications during your pregnancy also to start in.
Lactomagic and Moriga tablets.
Morico, correct. So start taking that and see for 1 week without formula. Like first get the weight gain, improve the weight gain first, work on weight gain, and then start reducing formula 10 ml every feed in the night. Okay. If the weight gain is steadily increasing, then keep following that But if the weight is still not increasing or the formula is still not coming down, then have one more call with her. She will explain it to you accordingly.
Okay,
Okay.
but I am giving him the uh, expressed breast milk also in the entire day. After pumping,
So
I
even
am giving
so,
that.
imagine even after doing that, our weight is still not or up to the mark.
Yes.
Correct. So that means
Yeah.
we need to work around it. Even after
Okay.
giving formula milk also, we are still not improving, getting the weight what we desired. Okay.
Right.
For weight, start giving him hind milk more, which I just told you, and
Yeah.
start taking all the medications which were advised to you. Start reducing 10 ml in the night. This has to be done slowly. First, gain the weight. Okay, what is
Okay.
required. Then 10 ml start reducing every session, and then see if it is working, going fine. You can just continue the same. If it is not going fine, then reach out to the doctor and have a call with her. Then that.
Okay.
Okay.
Thanks a lot.
Welcome. Pranjal.
गुड इवनिंग मैम।
Good evening.
एक्चुअली मुझे पूछना है कि मैंने ना महिमा मैम का कंसल्टेशन लिया हुआ है और उनका प्रोटोकॉल मैं ट्राई कर रही हूँ फॉलो करने का, बट कुछ कुछ चीजें स्किप होती जा रही है मेरे से, क्योंकि जो घर पे है रूटीन की वजह से वो हर कोई चीज
क्या चीज छूट
पॉसिबल,
रही है बताओ, क्या चीज छूट रही है?
जैसे कि अभी पंपिंग है या हैंड एक्सप्रेशन है वो जो करना है, तो अगर फीडिंग में तो उसको ब्रेस्ट फीडिंग करवा रही हूँ हमेशा, बट उसका
एक
था
हफ्ते का
60
वेट गेन बताओ।
मैम उसका ना 5.7 था, और अभी 5.850 ऐसे था।
ये कितने दिन में बढ़ा है ये 150 ग्राम्स?
ये 7 डेज में।
और बेबी का एज क्या है?
5 मंथ्स कंप्लीट हो गया है उसको, फाइव
तो
मंथ्स
वेट तो बहुत
15।
अच्छा है। 5 मंथ्स का बेबी का तो हमको 100 ग्राम्स पर वीक चाहिए। ठीक है, तो
हाँ
हमको 150 मिल रहा है, तो वेट तो हमें बहुत अच्छा मिल रहा है। ठीक है प्रांजल।
हाँ, बट
अब
मैम एक्चुअली उसका हाँ ठीक है मैम, आप
फॉर्मूला
बोलिए आप
कितनी
बोलिए।
बार दे रहे हो आप?
वन टाइम ही, तभी मैंने जब कंसल्टेशन लिया ना तो मैं 60 ml वन टाइम उसको, जैसे नीड जैसे लग रहा है मुझे कि वो नहीं रुक रहा है, तो वो टाइम पे मैं उसको 60 ml दे रही थी। अभी फिलहाल मैं दे रही हूँ, बट कम कम करके मैं ऐसे हमेशा नहीं दे रही हूँ कि
ठीक
ये जो 7 दिन थे उसमें,
ठीक है, तो
तो
देखो प्रांजल, हमको
फिर
वेट थोड़ा ज्यादा मिल रहा है, हमको 50 ग्राम्स एक्स्ट्रा ही मिल रहा है। तो जो कभी कभी
हाँ
दे रहे हो ना, वो आपका आपका यही मोटिवेशन होना चाहिए अभी। ये पंपिंग और हैंड एक्सप्रेस अभी कर लोगे ना, तो ये जो कभी कभी देना अभी जो
हाँ
पड़ रहा है ना, एक तो वो भी चला जाएगा। तो ठीक है, अपने लिए एक ये
ओके। और मैम
मोटिवेशन बनाओ। हाँ।
हाँ, तो ये अभी हैंड एक्सप्रेशन के टाइम क्या होता है, घर पे सब लोग कोई ना कोई है, तो कुछ ना कुछ करना है, और मेरा बड़ा बेटा भी है तो उसके तरफ भी ध्यान देना है और घर का भी देखना है, तो उसमें ये सब चीजें छूट रही है मेरे से,
तो उसका
तो वही
उसमें
मैं।
क्या करो ना, जब खाना खाते
हाँ
हो ना, ठीक है, खाना
हाँ
खाने के बाद ऐसा करो, थोड़ा 5 मिनट के लिए बस बाथरूम में चले जाओ। ठीक है।
ओके।
या कोई
हम्म।
स्टोर रूम वगैरह होगा तुम्हारा, कोई भी रूम एक अलग हो,
हाँ
उसमें चले जाओ। और वहां जाकर के एक कटोरी में, मतलब बाथरूम में हैंड एक्सप्रेस मत करो, आई मीन टू से, मगर एक कमरा कोई
यस।
ऐसा हो जहां पे बस 5 मिनट के लिए जाओ, बंद कर दो
हाँ
और हैंड एक्सप्रेस कर लो, और उस समय ना थोड़ा शांत भी रहो। क्योंकि पता है ना क्या होता
ओके
है, आपको बहुत घर में चीजें चल रही हैं, एक बड़ा बेबी भी है, छोटा भी है, घर की देर काम है। तो ये अपने लिए ना मी टाइम समझ लो, ये तुम्हारे मी टाइम है।
ओके।
ठीक है, तो ये तुमको मोटिवेट भी करेगा, वो दिन में 2 3 4 बार
यस।
ऐसे करोगी ना, तो तुम्हें भी अच्छा लगेगा। तो हैंड एक्सप्रेस वहां कर लो, और उस समय थोड़ा शांत, गहरी सांस लो, रिलैक्स करो। तो वो तुम्हारा मी टाइम भी हेल्प हो जाएगा। और एक बार कभी कभी देना पड़ रहा है ना, तो वो जो मिल्क है ना, वो तुम्हारा वहां यूज होगा, बेबी का वेट हमें अच्छा मिल रहा है, आराम से प्रॉब्लम सॉल्व हो जाएगी। ठीक है।
ओके फाइन मैम। और वही मैंने निप्पल का जो पूछा था ना, वो लैचिंग का मुझे आपने मुझे आंसर किया था कि निप्पल पे मुझे व्हाइट स्पॉट आ रहे हैं, और
हाँ,
मैं
ये
वो
लैचिंग का
कर।
इशू है।
हाँ, तो वो उसका भी, उसके अभी जैसे
इसमें
ये थोड़ा
यूजुअली
सा।
मैंने देखा है, यूजुअली ये जो 4 5 महीने के बच्चे होते हैं, जिनके बड़े भाई बहन
हाँ
होते हैं, ये खेलने में
हाँ
लगे होते हैं। वो बड़े भाई
हाँ,
बहन के साथ खेलने में लगे होते हैं, तो वो ठीक से फीड नहीं करते।
वो
तो
इधर इधर देखते हैं,
इधर इधर
हाँ।
उधर, हाँ करेक्ट। तो
राइट।
इसीलिए इसीलिए उनका ये लैचिंग का इशू होता है। वहां पे क्या करो कि कोशिश ये करो कि बड़े वाले बच्चे को समझाओ कि जब मैं फीडिंग कराती हूँ तो एक समय बातें मत किया करो उस समय, क्योंकि
ओके।
उनको भी शौक आता है ना बच्चों के साथ, भाई के साथ,
वो
बहन के
वो
साथ
वो
खेलने के
मेरे
लिए।
साथ, मेरे हाथ में दो उसको, मुझे मेरे हाथ में दो, वो उनका
तो
चलता
उस समय
रहता है,
उसको
तो उससे।
उसको उस समय आप उसको सिखाओ कि उस समय मत बात करो। और उसके सामने भी
ओके।
घूमते रहते हैं ये लोग, देखते रहते क्या हो रहा
यस।
है। इनको बोला कि
यस।
थोड़ा पीछे थोड़ी देर रुक जाओ, मैं फीडिंग करा लूं, उसके बाद खेलना उसके साथ।
खेलना
तो उससे
उसके
ये
साथ।
डिस्ट्रैक्ट नहीं होंगे, लाइट्स थोड़ी कम कर दो, उसके बाद फीड कराओ, तो चीजें ठीक हो जाएंगी।
ओके ठीक है, थैंक यू।
वेलकम। निखत।
हाँ हेलो मैम।
निखत, यू हैव टू ओपन योर कैमरा।
हेलो मैम।
यस निकल, बताइए।
मैम, मेरा ना बहुत सारा कंसर्न है। सबसे पहला कंसर्न तो ये है कि मेरा डिलीवरी जब हुआ था, अभी मेरा बेबी 3 मंथ्स और 20 डेज ओल्ड है। तो जब मेरा बेबी हुआ था तो उस टाइम मुझे
एक
निपल में
मिनट, एक
थोड़ा
मिनट का देखो, इतना लंबा बात करने के लिए हमारे पास टाइम नहीं रहेगा, बहुत सारे मदर्स हैं। अगर आपको ऐसा लंबा है तो आप कंसल्टेशन बुक कर लो। मुझे एक पॉइंट बस फटाफट पूछो जिसका मैं आंसर दे
अच्छा
पाऊँ।
मैम, अभी क्या प्रॉब्लम हो रहा है कि मतलब वो मेरा मतलब फ्रीक्वेंट फीडिंग करने मांगती है मेरी बेटी, बार बार फीडिंग करने मांगती है। और ट्वेंटी
फॉर्मूला
टू
कितनी
ट्वेंटी
बार दे
फाइव
रहे हो
मिनट्स
आप?
जी मैम।
फॉर्मूला दे रहे हो आप उसको?
हाँ यस मैम, फॉर्मूला देना
कितनी
पड़ता
बार
है
दे रहे हो?
क्योंकि 2 बार देती हूँ मैं शाम से। दिन भर मैं अपना फीडिंग
बड़ी
कराती
बच्ची,
हूँ।
एक मिनट, बच्ची कितनी बड़ी है आपकी?
3 मंथ्स 20 डेज।
ठीक। देखो, 3 मंथ्स के आसपास ग्रोथ स्पर्ट आता है, जिस समय बच्चे जल्दी जल्दी डिमांड करते हैं। वो नेचर का तरीका होता है मदर का मिल्क बढ़ाने के लिए। तो पहली चीज तो, अगर वो फ्रीक्वेंट फीडिंग कर रही है, उसका वेट ठीक है, तो आप उसकी चिंता
जी
मत करो। जो आपका फॉर्मूला मिल्क चल रहा है उसका 10-10 ml कम करो, और बच्चे का वेट देखते रहो। और साथ में जो मैंने चीजें बताई हैं आपको, अगर आपने पहले कंसल्टेशन हमारे यहाँ से कभी लिया हुआ है
नहीं
पहले, तो
जी नहीं
आप
मैम।
उसमें आप दो चीजें कर सकते हो। या तो आप एक हफ्ते के लिए जो चीजें मैंने बताई हैं उनको आप फॉलो कर सकते हो, और फिर देखो अगर आपको
जी
इम्प्रूवमेंट हो रहा है तो आप उसको कंटिन्यू करो। नहीं तो आप एक कॉल
जी।
बुक करके उनके साथ अपने लिए कस्टमाइज प्लान बनवा करके उसको फॉलो करो, एंड करते रहो उसको आगे।
अच्छा मैम, लेकिन मैम वेट गेन भी बेबी का सही नहीं है क्योंकि आपसे मैंने क्वेश्चन किया कि आपने कहा कि 3 and 20 months ओल्ड
देखो, अगर वेट गेन भी
कंटिन्यू।
नहीं है, अगर वेट गेन भी नहीं हो रहा है, बच्चा रो भी रहा है, बच्चे का पेट भी नहीं बढ़ रहा है, आपको फॉर्मूला भी देने के बाद वेट नहीं बढ़ रहा है, इसका मतलब सप्लाई
जी।
कभी पूरी तरीके से नहीं है निकल। फिर तो यहाँ पे
अच्छा।
ऑब्वियस सी बात है, 3.5 महीने का बच्चा हमारा ऑलरेडी हो गया है। अब हम और
जी
इंतजार उसका नहीं करेंगे। तो फटाफट
जी
इसके
मैम।
ऊपर काम करके अपना मिल्क बढ़ाइए। और मिल्क बढ़ाने
जी।
के लिए वही मैंने आपको बोला, आप एक हफ्ता सब चीजें ट्राई कर सकते हो जो मैंने आपको बताई है। वरना आप फटाफट अपना कंसल्टेशन बुक करके उनके साथ चीजें भी कर सकते हो, जो आपको ठीक लगे उसके अंदर। ठीक है।
अच्छा मैम, मैम एक और चीज बोलूं। मतलब मेरा बेबी का क्या प्रॉब्लम है ना कि वो मतलब जो भी मैं मिल्क पीती है ना, मतलब अगर मैं फॉर्मूला 60 ml बना कर दे रही हूँ तो वो 60 ml पूरा नहीं पीती है। वो मतलब थोड़ा सा पिएगी, फिर छोड़ देगी, फिर थोड़ा देर बाद
देखो,
15-20 मिनट बाद फिर पीने मांगती है।
3 महीने के बच्चे जो उसके ऊपर होते हैं वो थोड़े डिस्ट्रैक्टेड रहते हैं। लेकिन अभी उसका वेट क्योंकि कम है, तो इसलिए आपको रेगुलरली उसको फीड कराना है। वो एक बार में नहीं पिएगी,
जी।
विच इज फाइन, लेकिन आप उसको फिर जल्दी जल्दी फीड कराओगे। ठीक है।
अच्छा ओके मैम, ओके ओके मैम, ठीक है मैम, थैंक यू सो मच।
वेलकम। आर के, हु इज आर के?
Yes, this is Ritu here.
ओके, यस रितु, प्लीज टेल मी।
Yeah. Okay. I just wanted to check with you one thing. From my left nipple, उसमें ना मुझे लगता है ब्लड क्लॉट हो गया है। थोड़ा ना मुझे ब्लैक पैच दिखता है निपल के अराउंड, तो उसको ब्लड क्लॉट भी बोलेंगे।
अब कोई इंजरी
तो
तो नहीं
उसके
है
लिए
ना?
क्या
कभी
करना
बच्चे ने
चाहिए
हेड
क्योंकि
तो नहीं मारा है?
फीडिंग नहीं हो रही है।
कभी बच्चे ने हेड वगैरह तो नहीं मारा
मुझे
है उस पे?
एक्चुअली नहीं, हेड तो नहीं मारा, बट मुझे डे 1 से ही दोनों ही निपल में बहुत प्रॉब्लम था। तो और ब्लीडिंग लेफ्ट निपल से होता था, वो ठीक हो गया ब्लीडिंग। बट मुझे लगता है ब्लड क्लॉट और ये 2 मंथ्स के ऊपर हो गया है।
ओके, तो वो पेनफुल है जो ब्लड क्लॉट है?
यस, क्योंकि लैचिंग के टाइम पे तो मैंने लेफ्ट से मैं लैचिंग ही नहीं कर पा रही हूँ। मैंने बहुत कोशिश किया, नहीं हो पा रहा है।
ठीक है, तो यहाँ पे मैं आपको सजेस्ट करूंगी कि आप थोड़ा मसाज और सिकाई करके इसको करने की कोशिश करो, एक्सप्रेस करो। लेकिन अगर बहुत पेनफुल हो रहा है तो उसको बहुत पुश नहीं करना, नहीं तो फिर से ब्लीडिंग स्टार्ट हो जाएगा उसके अंदर। ठीक है। तो अभी
ओके, मैं
आपको इसका
एक्सप्रेस
मतलब
तो
कि
करती
आपकी,
हूँ।
हाँ, एक्सप्रेस आप करते हो, वो मिल्क ठीक आ रहा है, उस समय तो पेन नहीं होता ना आपको?
नहीं
और
नहीं
ऐसा तो नहीं होता है कि जिस समय मिल्क ब्रेस्ट में ज्यादा है उस समय ज्यादा पेन होता है उसमें?
नहीं, ऐसा कुछ नहीं है।
ऐसा कुछ नहीं है। तो बेसिकली बस बच्चा
नहीं।
जब लैच करता है तो आपको पेन होता है।
यस।
करेक्ट। तो
यस।
इसका मतलब कि
यस।
बच्चे की लैचिंग या तो फिर शैलो है, क्योंकि अगर पंपिंग करने में कोई पेन नहीं है लेकिन अगर लैचिंग में पेन है, तो इसका मतलब लैचिंग ठीक नहीं आ रही है। उसका जो हार्ड
हाँ।
पैलेट है वो आपके निपल पे आ रहा है, जो आपको पेनफुल है। तो अगर आप डीप लैच करवाओगे तो आपको ये पेन चला जाएगा इसके अंदर। ठीक है। आपका मिल्क सप्लाई
ओके,
ठीक है,
मैंने
आपको फॉर्मूला नहीं देना पड़ रहा है?
नहीं नहीं, मिल्क सप्लाई का भी प्रॉब्लम है। तो पहले 20 ml था इन वन गो में, अभी 50 ml हो गया है। तो ऑन एन एवरेज दिन भर में मेरा 350 ml मेरा दूध जाता है एक्सप्रेस करके। एंड उसको फॉर्मूला जाता है 250 के आसपास।
ओके, बेबी अभी कितनी बड़ी है आपकी?
अभी 75 days।
ओके। सो ठीक है,
टू
देखो
एंड
मैं भी वही वही मैंने अभी सबको भी बोला है कि आप 1 वीक नहीं तो ट्राई कर सकते हो जो मैंने आपको चीजें बताई हैं, नहीं तो आप सीधे कंसल्टेशन बुक करके आप वो भी कर सकते हो, इट्स योर विश आपका, क्योंकि हमको सप्लाई का इशू तो है ही इसका मतलब, और लैचिंग का इशू भी है। तो आप जो मैंने अभी
यस।
चीजें बताई आप फॉलो खुद भी करके 1 हफ्ता देख सकते हो, अदरवाइज सीधे कंसल्टेशन बुक करके भी अपनी चीजें सॉल्व कर सकते हो, इट्स योर विश
अच्छा।
इसके अंदर।
और मसाज तो मैं रोज डेली करवा रही हूँ, बट उसका भी कुछ फर्क नहीं पड़ा है अभी तक।
करवाने से कुछ नहीं होगा, आपको खुद करना होगा और कई बार दिन में करना होगा, 1-2 बार से नहीं काम चलेगा, हमको रेगुलर मिल्क का फ्लो चाहिए इसके अंदर। तो वही आपसे कंसल्ट करके वो पहले समझेंगे कि ये कैसा फ्लो का इशू कितना है, उसके अकॉर्डिंगली वो बताएंगे आपको कि कितना फ्रीक्वेंटली हमें मसाज सिकाई की जरूरत पड़ेगी इसके अंदर, दैट
ओके।
ठीक है।
और कई कई बार ऐसा होता है कि बेबी सिर्फ 10 मिनट्स ही लैच करता है, फिर उसके बाद लैच ही नहीं करता, तो उसका क्या
हाँ तो
रीजन होता है? वो काफी किक मारता है कि मेरे को ऐसा लगता है कि शायद दूध नहीं है क्योंकि किक मार रहा है
आप
वो।
बाकी टाइम पे जो एक्सप्रेस मिल्क है वो उसको बॉटल से दे रहे होगे ना,
हाँ।
तो फिर बच्चा बॉटल समझता है, ब्रेस्ट में जब तक शुरू का फोम मिल्क होता है वो फ्लो में होता है, इसका मतलब वेरी क्लियर
हाँ।
है कि हमारा फ्लो का इशू भी है। हाइंड मिल्क तक
हाँ।
बच्चा पीता ही नहीं है वो, क्योंकि गाढ़ा होता है उसको
करेक्ट।
खींचना नहीं चाहता। तो फ्लो का
करेक्ट।
इशू अपने को
करेक्ट।
क्लियरली पता चल रहा है, सप्लाई का इशू अपने को क्लियरली
करेक्ट।
पता चल रहा है, लैचिंग का इशू अपने को
करेक्ट।
क्लियरली पता चल रहा है। तो 3 चीजें हैं,
हाँ।
तीन पे काम होना है। करेक्ट।
हाँ। ठीक है, तो मैं बुक कर लेती हूँ फिर।
ठीक है, ओके। दिशा, दिशा यू कैन अनम्यूट।
हेलो।
देखो हाथ हाथ, कैमरा ऑन करिए दिशा।
हेलो मैम।
हेलो दिशा, कैसे हैं आप? दिशा तो
हेलो
देखी हुई लग रहा है,
मैम।
दिशा तुम पहले कंसल्टेशन ले चुकी हो।
हाँ जी मैम, मैं ले चुकी हूँ।
हाँ वही तो,
पर
तुम्हारा तो चेहरा
हाँ।
मुझे पहचान में आया। बताओ।
हाँ जी मैम। अभी मैम, आप हमें लास्ट टाइम बात हुई तब आपने बोला था 10-10 मिनट्स दीदी को दोनों साइड करवाना है। मेरा लो मिल्क सप्लाई का इशू था, और बाद में आपने बोला कि 30 ml फॉर्मूला बना के दे देना। पर बेबी है ना, 30 ml फॉर्मूला हम जब बॉटल से देते थे ना, तो धीरे धीरे करके उसको निपल कंफ्यूजन होने लगा और उसने बंद कर दिया मेरा मिल्क लेना। तो फिर हमने ट्राई किया कि बॉटल छुड़वाए, और मैं
हाँ।
कटोरी चम्मच से देने लगी उसको, तो वो है ना 10 ml जितना पीता है और फिर नहीं पीता, और नहीं भी पीता, कभी कभार ऐसा करता है।
वेट गेन
और फिर
बताओ,
अब
वेट गेन
बेबी
बताओ।
का अभी 4.3 वेट है।
ये कब का है?
ये अभी मैंने सैटरडे को करवाया था वैक्सीन देने के टाइम पे।
सैटरडे, यानी कि आज फ्राइडे है, पिछला सैटरडे ना, लगभग 1 हफ्ता पहले।
जी
तो
जी।
क्या हुआ, 5 अराउंड 18th या 18th अक्टूबर लिख लेते हैं। और उसके पहले का
जी।
बताओ कोई वेट।
उसके पहले उसका 3 पॉइंट, हाँ, 3.9 जितना था।
ये कब का था?
उसके 10 दिन पहले का।
ठीक है, तो 10 डेज में बेबी का वेट हमको 400 ग्राम्स मिल रहा है।
जी। पर
करेक्ट।
तब
और
उसको है ना मैं टू
बेबी का एज क्या है?
बेबी का एज 2.5 मंथ हो गया अभी। पर उसको है ना मैम, हम अभी कैसा है कि उस टाइम पे 200 ml तो वो पूरे दिन में लेता था फॉर्मूला। तो अभी एकदम से बंद किया ना, तो कैसा हो जाता है कि सो जाता है 10 मिनट और वापस से वो उठ जाता है खाने के लिए।
चलेगा
पर
अपने को दिशा?
ब्रेस्ट एम्प्टी
एक बात
होता है,
बताओ,
फिर वो
एक
रोता
बात
है।
बताओ, अगर फॉर्मूला मिल्क 200 ml से इतना कम हो गया तो वेट गिर जाना चाहिए था ना?
हाँ। तो
वेट तो
वेट
नहीं गिरा।
अभी 2 दिन से मैंने स्टार्ट किया है बंद करना फॉर्मूला। 2 दिन
ओके,
हुए अभी।
तो पहले 1 हफ्ता वेट देखो तो, अभी से
हाँ।
चिंता क्यों कर रही हो? अगर 1 हफ्ते
पर
में
मैम
उसका वेट गेन
अभी
ठीक हो रहा है तो बोलो।
स्टिल अभी मैंने उससे बॉटल से फीड कराया क्योंकि वो बहुत रो रहा था। मैंने देखा कि 2 दिन मेरा फ्लो अच्छा रहा, पर सडनली आज ऐसा लगा कि थोड़ा कम आ रहा है। मैं चेक कर रही थी प्रेस करके, तो दूध ही नहीं निकल रहा
चलो
था।
देखो, इसको मत चेक करो, तुम बच्चे को ही बस फीड कराओ। तो बॉटल जैसे तुमने दिया, तो आज फीड कर रहा है ठीक से ब्रेस्ट पे, या आज भी नहीं कर रहा?
नहीं, वो थोड़े टाइम फीड पे अच्छे से ब्रेस्ट कर रहा, फीड ले रहा है, फिर है ना 5 मिनट होता है, फिर वो अनलैच हो जाता है। फिर मैं ट्राई
मसाज
करती
सिकाई
हूँ,
कितनी
फिर
बार
नहीं
कर रही
लेता।
हो? मसाज सिकाई
वो मैं
कितनी बार कर रही हो?
4 बार कर रही हूँ।
कर रही हो रेगुलरली? मेडिसिन सारी टाइमली ले रही हो? सब डोजेस
हाँ
ठीक से
वो
ले
भी।
रही हो? ठीक है। देखो
हाँ।
यहाँ पर अभी एक काम करो, पहले तो चिंता मत करो। अगर फॉर्मूला
हम्म।
कम भी हुआ है, पहले उसका एक
हम्म।
हफ्ते का वेट देखो, क्योंकि ये वाला वेट तो हमें अच्छा है। 10 डेज में
हम्म।
हमको 400 ग्राम्स मिला है, 40 ग्राम्स पर डे। ये तो हमारा और हायर साइड है, हमें तो 30
हम्म।
ग्राम्स पर डे चाहिए, 25 से
हम्म।
30 ग्राम्स, ठीक है। तो
हम्म।
वेट गेन हमारा उधर अच्छा था। अब इधर अगर
हम्म,
फॉर्मूला कम भी हुआ है तो पहले घबराओ मत, पहले 1 हफ्ते का
ओके।
वेट देखो। अगर 1 हफ्ते का वेट ठीक है तो फिर उसको
हम्म,
फॉर्मूला हमें वैसे भी नहीं देना है।
पर मैम वो अभी बहुत रो रहा था, तो मैंने अभी 60 ml बॉटल से फीड करवाया ना, तो उसने वो फटाफट ले लिया,
ठीक है,
क्योंकि वो
तो
और
लेकिन अब
सोता
अब
नहीं है वो।
अब लेकिन बताओ ना, ये फीड लेने के बाद फिर वो तुम्हारा फीड लंबा नहीं लेगा।
पर मैम वो सोता ही नहीं है पूरे दिन, सुबह 6 बजे से उठा है ना, अभी तक वो
ठीक
सोया
है,
ही
तो तुम
नहीं है।
अब एक काम ये करो कि लेकिन अपना मिल्क एक्सप्रेस करके कोशिश ये करो कि तुम अपना मिल्क उसको बॉटल में दो, अगर कभी बहुत रो रहा है तो। फॉर्मूला कोशिश
ओके,
करो कि ना देना पड़े।
ठीक है।
ठीक है, ये करो, 1 हफ्ता पहले वेट देखो, फिर देखते हैं
हाँ,
इसका। ठीक है।
ओके, थैंक यू मैम।
ठीक है, तो आज के क्वेश्चंस हो गए हैं, लेट्स। तो हम लोग अब अगले हफ्ते मिलेंगे फ्राइडे को, सेम 7 PM। अगला फ्राइडे आई डोंट थिंक दिवाली है क्या, बट डेट चेक कर लेते हैं। 1 नवंबर 1 नवंबर दिवाली नहीं है, 31 की है नवंबर दिवाली। सो हम लोग मिलेंगे फ्राइडे को। सो सी यू ऑल नेक्स्ट फ्राइडे। टेक केयर एवरीवन, और सब बस टेंशन नहीं लेनी है किसी को भी, सब अच्छे से करो, सब ठीक हो जाएंगे इसी से। ओके, बाय।